Hi, everyone. We'll get started. Thanks for coming today. So I'm Leo Waterston. I was asked to facilitate a discussion today with this group about what's happening at the federal level and how it affects all of us here in Maine. I spent a lot of my career here in Maine working in healthcare and public health and economic development. And I'm here as a concerned citizen and a resident of Maine. I live in South Portland. So I'm going to ask each of you to just briefly reintroduce yourself to the group, and then we can jump into the discussion. Hi, everyone, again. My name is Everal Eaton. I am the Executive Director of the Bar Harbor Chamber of Commerce. We work very closely with Acadia National Park, and we also represent the Visit Bar Harbor brand.
Hi, everyone. I'm Tessa Corsetti. I, until recently, was a wildlife biologist with the U.S. Fish and Wildlife Service. I was terminated on February 14th with over 400 of my colleagues, and I am based out of Kittery, Maine.
Hello, I am still Scott Gagne from Gray, Maine, a certified prevention specialist. I was the regional director for SAMHSA, for Substance Abuse Mental Health Services Administration, covering the states of Maine and rest of the New England states, supporting states in addressing our addiction and behavioral health challenges.
Hi, I'm Jill Harlow. I'm the Chief Operating Officer at the Maine Coast Fishermen's Association. We are based out of Brunswick, but serving fishermen all along the coast of Maine.
Good morning. My name is Alan White. I previously worked at Togus, Maine, and I was fired due to the probationary firings brought on by the administration.
Thank you. My name is Ocean Crawford. I live in Bangor, and I'm speaking on behalf of benefits of SNAP and MaineCare.
Ocean, actually, you can keep the mic. Maybe I'll start with you. Sorry. So you mentioned that you're studying at Eastern Maine Community College. Love to hear more about what you're studying and what your career goals are after you finish your education.
So I enrolled at Eastern Maine Community College in January. It's my first semester, and I'm going for my associates in Health and Human Services. I would like to start my career path in case management. I've benefited greatly from case management services in the area, and I'd like to contribute.
It's great. And you talk a little bit about how the programs you mentioned that you and your family are using, how those are helping you achieve those goals.
Well, it gives security in a sense where I wouldn't really, it'd be a lot harder to figure out where I would get some assistance when needed.
I'd like to hear more about Acadia, and you mentioned the economic impact that Acadia has on certainly the Bar Harbor region and the state. But if you could talk a little bit about the cuts to staffing there and the broader impact that has on the region and the state of Maine.
Sure. So I mentioned before that visitor spend study in 2023 reported that Acadia National Park was responsible for generating $475 million, and it helped to generate locally 6,600 jobs. So through that study, on average, a visitor spends about $120 in the local town. Bar Harbor is the gateway town to Acadia National Park, and I often speak about how Acadia National Park and Bar Harbor go hand in hand, and something that drastically affects one will affect the other. So for the park, they've traditionally had struggles hiring the 150 seasonal employees, and they've worked on different projects with groups like Friends of Acadia on housing. And I think what we're noticing is it's a great thing that the federal hiring freeze on the seasonal staff has been lifted. But it does put stress on a park that has traditionally had a hard time hiring the 150 staff members. They traditionally start hiring in January when the freeze went into effect, and a bunch of offers had to be rescinded. Some employees did come back from those offers when the freeze was rescinded, but and on top of a traditionally hard workforce to hire for, it put more undue stress. Really what we're worried about is the park being able to do all that they have to do to maintain beautiful park that we have in our backyard. So we strongly believe that they need the staff to come in, because traditionally they have been understaffed.
Can you talk a little bit about the work that you were doing with Fish and Wildlife, what that work means for Maine and our community?
Sure. So my official title with Fish and Wildlife was the Regional Bat Coordinator, and my responsibilities were to streamline review processes and increase agency efficiency while supporting the development and implementation of conservation and management plans for northeastern bats. And all of it was to advance bat conservation in the Northeast and beyond. I worked very closely with stakeholders and partners all over the state of Maine, as well as New England and into a lot of the United States. I was the tricolored bat lead for the nation as well. And so my work expanded well beyond New England. But I was working really closely with our partners and stakeholders to try and make it so that we could make the environmental review process easier for development and progress. We're absolutely in favor of sustainable development and responsible development. And my job was to make that easier for people, to make sure that they could go to one place and have all of the information that they needed and be able to do all of this work that they needed to do while still protecting bats and other endangered species. My job was to increase efficiency. So unfortunately, the loss of that has been in direct contrast to what this administration says is their priority.
And Tessa, for those who may not be as familiar with bats and kind of the connection between bats and the world that you work in there and things like public health, food that you mentioned earlier, can you talk a little about those connections?
Sure. So bats are the second largest mammalian group in the entire world. There's 1,400 different species of bats that we know of. Maine has 8 different species, but they also are experiencing the most significant mammalian die-off event of this century. Bats are really important because they're vital for seed dispersal, pollination, pest control. It's estimated that bats can save North American farmers over $3.7 billion per year in just decreasing pesticide use and general ecosystem services. And I should also say that number was estimated in the early 2010s. So it's very difficult to quantify something like that. So I can only assume that the number has gone up. But the ecosystem services that they provide are invaluable, especially considering the fact that last year, New England started to see an increase of mosquito-borne illnesses, which is really, really concerning. And bats are a predator of mosquitoes. And with the huge amount of bat die-off that we've seen in the past 2 decades, that it will likely be affected. The mosquito-borne illnesses are going to continue to be an issue with climate change, and the loss of bats will only make it worse. And I should say, I've talked about the loss of bats. They are experiencing a die-off event from an invasive fungal pathogen called white nose syndrome. And this invasive pathogen was first introduced to upstate New York in 2006 and has since been responsible for the deaths of millions and millions of bats. It's really difficult to know exactly how many because we don't actually know how many bats we had prior to the introduction of this pathogen. But we do know that since then, the numbers of bats killed are just astronomical. So it is a vital thing to try and protect, and my job was to make it more efficient and to make sure that we were doing everything that we could to protect bats while also allowing development and progress in Maine and beyond.
Thank you, Tessa. Sion, can you talk a little bit, Scott, about the work you were involved in with SAMHSA and what that means for Maine?
Yeah, so as a regional director, basically I'm sort of a bi-directional representation of SAMHSA here in New England, here in Maine and the rest of New England. First of all, I'm proud to say I'm the first Mainer that's been in this position. All the previous regional directors were from Rhode Island. No offense to Rhode Island, but it's really cool to have a Mainer in the position. And that's really interfacing with just about anyone you can think of in Maine that's touched by behavioral health or addiction. So one of our primary stakeholders are the behavioral health leadership in Maine. So that would be the Maine Office of Behavioral Health, Maine CDC. There's a lot of federal SAMHSA dollars that come to both of those offices to fund programs across the spectrum. So it's preventing substance use amongst young people. It's treatment services for people with substance use disorder. It's recovery services, harm reduction services, all across the spectrum. However you're touched by behavioral health or addiction, there's a SAMHSA-funded program in Maine that helps address these issues. And grants had project officers at SAMHSA headquarters, but those folks are really in charge of compliance with grants, not really troubleshooting or to provide any sort of additional technical assistance. That's really my job, is to work with Maine OBH, the Maine CDC, if they're running into a barrier or a challenge, to help them think through, how do we overcome that? How do we potentially bring in the other New England states together to look at some regional opportunities, which actually is something I was involved in before I got fired. We were getting ready to launch a really cool project in New England where all the 6 states were going to look at some information and data sharing and collaboration to get a better, more timely information on the illicit drug supply that's coming into our region, because it can change so fast and so rapidly, and is really how timely you have the information is a matter of how many people die from an overdose. Because if you can have better real-time information on that, there's better opportunities to get word out to recovery centers and different entities to spread that information to try to protect and save people. So that's a program that's not going forward now with my firing. And I could give a couple really specific examples where I was a benefit for me. SAMHSA runs a national helpline for substance use and behavioral health services. And the way it works is, depending on what state you're calling from, you get routed to a different kind of center. And I discovered that it wasn't working for Maine. And the way I found out is a citizen from Maine was trying to call SAMHSA headquarters, couldn't get a hold of anybody. They finally found my number and called me, and I was able to call headquarters and get that fixed. So I don't know for how long, maybe a period of months, like that service just was not functioning for me. So myself and my office was able to get that fixed. So that's another role that I and my office plays, is not just with the leadership, behavioral health leadership, but people who are receiving services or trying to access services, to work with them to address the different challenges and issues come up that headquarters can't kind of help with. So the regional offices are really, really important to kind of weave everything together, to be a support. And also the fact that we all come from the regions. I have 9 other counterparts across the country. I'm from Maine. I'm from this region. And so I know stuff on the ground that folks at headquarters will not know, and to make sure that services are adequate and appropriate for the people in our state. And again, as I mentioned before, one thing, again, I want to stress that along with the cuts, some of these executive orders is really going to provide some challenges, especially the executive orders with DEI. I'm very concerned about the impact that's going to have on the underserved, marginalized populations in our state. And without a regional director in the role to try to advocate for our folks, I'm fearful for how that's going to turn out and affect on the lives of Mainers.
Thanks, Scott. And can you just speak a little bit more about who you serve with these programs here in Maine?
Everyone. We serve anyone and everyone in Maine that's affected by behavioral health, mental health, or addiction. So as I mentioned, there's 2 major block grants. There's a substance use block grant that funds basically substance use disorder treatment services, recovery, and prevention services, and then also some harm reduction as well. And then there's a mental health block grant that funds all the mental health services. And then there's many discretionary grants that the state and other groups will apply for, to address those different kind of behavioral health services. So really, again, SAMHSA really is, the SAMHSA funding is really the lifeblood of the behavioral health system in Maine and all the other states. I mean, there's a lot of great people that do the actual work, but the money, the funding, a lot of it is a SAMHSA funding. So the cuts to the staffing and potentially to the funding is going to have real impacts here in Maine, because there's really not a lot of other funding that can replace it. And even if the funding is saved, like less staff. So, for example, about 25% of the staff at the 988 office at SAMHSA were cut. Many people in the office of recovery at SAMHSA were cut. So that's going to have trickle-down effects to recovery services, to 988 services. If something breaks with 988, how fast will it get fixed? I don't know. With a quarter of the staff not there.
Sure. Joe, can you talk a little bit about, you mentioned NOAA
funding, just the impact that an agency and the programs coming out of NOAA have on the work that you do with the Maine Coast Fishermen's Association supporting
the fishing and seafood industry here today.
Sure. Thanks, Leo. So I think to start off, fishing shouldn't be about politics. Fish is food. These are small businesses sustaining our local economies. And when cuts happen to NOAA, and NOAA is the agency that regulates harvests and sets the science so that we know how many fish can be caught. It makes everything that we do harder. The people that we need to call to get things done for our fishermen either aren't there anymore, or they're trying to do 6 jobs all at once just to make sure that our guys can get out on the water and still make a living. So it makes everything we do harder. And we are in a situation right now where we expect that there will be at least a month's delay to the start of our scallop season. We don't know, unless there is an emergency action put in place, when our ground fishermen will be able to fish. That's an incredible amount of uncertainty. Fishermen deal with uncertainty every day. They fight the North Atlantic to bring us seafood for our tables. They deal with incredibly uncertain seafood markets. They don't know when they land their fish if they will make a profit. And then you add layers of uncertainty around, can we even go fishing? When will that happen? How do we plan our business? And these aren't giant businesses. These are small family-owned operations. These are, 2 or 3 people on a boat eking out a living and sustaining our coastal communities. They are the original ocean stewards. They are the original caretakers of our coastal communities. So when we take those resources that they need away from them, that's very difficult. As a nonprofit, we're really lucky. We have a pretty diversified funding stream. Not that we won't be hurt by cuts, but we will be here and we will be working for fishermen. But everything we do is getting harder. And we are losing hours of every day navigating the chaos so that we can provide services and resources and good information for fishermen. I think the other thing is, we're all focused on the urgency of now. And the urgency of now is really, really important. But what we do in this now has repercussions down the road. The cuts that we make to our ability to get good science will be difficult to overcome. We are already at a place that much of our science is broken. It needs more investment. It needs reinvestment. It needs different ways of doing things that are collaborative with fishermen that harness their knowledge. And if the staff at NOAA is struggling just to survive the day, they can't take those leaps that are going to make things better for the future. Why would you like, Alan?
Alan, could you talk a little bit more about the programs that you were involved in at the VA and what those programs mean for Mainers or our community?
Sure. So working at the VA, our mission's veterans, so it may not affect everybody, but I'm pretty sure everybody knows a veteran. I was the education technician for the education service line in Togus, Maine. I mainly dealt with the TMS, talent management system. It's the program that houses all the training for all the medical staff. There's always a huge push for training and revamping training, cutting training hours, and without my position, that's putting the work on about 6 other people in my department and causing other people to work overtime. My program in itself, I also dealt with the new employment orientation. So anybody that was coming in, I facilitated their onboarding. It was about a 4 to 5 day program. With me not being there now, it's again put on someone else to work overtime to actually get that job done. I was also in a couple other projects doing yellow belt stuff. One of the biggest projects I was a part of was the efficiency on how to get broken equipment fixed. There was a huge broken chain as far as identifying, hey, this equipment's broken. This is how it gets fixed. The turnaround times were a bit iffy, and I was part of our team that actually did that.
So, my next question is something that Jill actually just touched on, but I wanted to get a little bit more from all of you on your perspective of what you see as some of the long-term impacts of potential cuts, whether these programs would be, permanently reduced or eliminated, or whether positions would be permanently eliminated. Can you talk a little bit about what you see as the long-term impacts of what's happening in the here and now?
Sure. So again, we represent the Visit Bar Harbor brand. So I think for us, when we look at that, we think about the visitor experience and what Acadia National Park is able to do to service the 4 million plus visitors that come every year. I think we're fearful that it could be long-term impacts like different trails being closed or bathrooms not being able to be maintained, and just kind of the uncertainty that creates for visitors. I think when people are trying to plan their stay, the last thing that they want is more stress added on to their trip, and that goes for locals experiencing the park too. So I think kind of when we look at long-term impacts, it's the ability for the park to maintain the natural beauty that we've been gifted, and again, kind of how that will affect our community economically.
Well, I don't think it's a secret that a lot of government agencies, especially those in natural resource conservation and research, are chronically understaffed. I know at Fish and Wildlife, our agency's organizational charts have had unfilled positions for a very long time. And the creation of my position was a good demonstration of how Fish and Wildlife was actually trying to get ahead of the of inefficiencies and the workload issues. And I am not the only one who is in this position. Obviously, like I said, it was over 400 of my colleagues. That's just at Fish and Wildlife. And they were already understaffed. And so the work that we were all working on is, I think that our colleagues are going to do the best that they can. And I know that they will do the best that they can for as long as they can, but there is only so much that people can do. And unfortunately, most threatened and endangered wildlife is in that state because directly or indirectly by human impacts. Cutting positions and rolling back regulations and refusing to talk about these issues is not going to make it go away. And these are your resources. They belong to the people of Maine. These animals and these habitats and these resources that they provide are yours, and they are being taken advantage of and pillaged and just disregarded by the federal government because they don't seem to be as profitable as other things. And it's not a renewable resource. You can't get it back. So we have a responsibility to fix the damage that we've done. Fish and Wildlife, NPS, all of these amazing nonprofits and consulting companies, we are all doing the best that we can to protect your resources, and we are not being allowed to do that by this administration. And it's going to be really difficult to recover if we are ever even able to. So it's your resources that they're taking.
I could talk an hour about this. I'm very fearful about the long-term implications. You just kind of speak from the SAMHSA perspective. So I did oversee a small team of 4. So half of us were fired. There's 2 that remain, but they're both looking because, and I think this is important to put out there. And I'm only speaking for SAMHSA. I'm not speaking for other agencies, but the workplace environment is pretty toxic right now for those who are left behind. So I just want to plug. You got some fired feds. There's some current feds that are going through some stuff right now. Let me tell you. And I don't blame them. And so that's going to leave this region, Maine and New England, without regional representation at SAMHSA. So that means services are not going to have the voice of New England when they're creating grants or they're creating programs. They're not going to have our voice involved in that. And so that's going to have dramatic impacts on Maine, because the reality is, as much as they want to push back against DEI and all this stuff, the reality is when it comes to behavioral health, different populations have different risk factors and different things that are going to be more impactful. in terms of services. So without that voice, without that input, there's going to be populations that will be unserved for at least the next 4 years, probably longer, because you can't turn behavioral health on a dime. It's like a cruise ship or whatever metaphor of a big thing you want to use. It doesn't turn quickly. And so that disruption, I think, unfortunately, is going to have a very long tail. It's going to go on and on. And then even if we get past this administration and there's a new administration that's more favorable to behavioral health and having, I question how many people will come back. I mean, I've heard from many of my colleagues that I want to continue to serve. I'm never serving in the federal government again after this environment. So we're losing some extremely gifted and talented people. Everyone at this table. Lots of other people in Maine, lots of people across the country. They'll find work, they'll find ways to survive, but the country is losing a lot of talent that can help address all these major issues that we're dealing with. And that's going to have long-term impacts. So again, people will be able to survive individually, but as a country, we're losing a lot that we're going to be dealing with, I think, for decades.
So I think it's interesting. At the Maine Coast Fishermen's Association, our motto is, together we persevere. They call it fishing. They don't call it catching. We're in the business of chasing hope. That's what we do. So I always try to look on the hopeful side of the long term. And I do believe that if we have the delegation's support, we will find a way to work with this administration and create better outcomes and better opportunities for our fishing community. But I also think about this in terms of sort of the 360 degrees of services that surround fishermen. So it's not just what you do on the water. It's when you land that catch, is the shoreside infrastructure stable? Are you getting a fair price for your catch? What's going on with our seafood markets? There are food entrepreneurs in Maine that are creating incredible value-added products to get more seafood on our school lunch menus. What will happen there? We want to make sure that there aren't disruptions to that because we want more kids eating healthy seafood for their minds and bodies. There are significant implications for the mental health of fishermen as they're going through this stress, and the physical health of fishermen when they're dealing with compressed seasons and trying to get as much as they can. There are implications for our working waterfronts and the character of our coastal communities, and for our food system. For the first time, we felt like we were starting to get some traction around recognition that fish really is food, and thinking about that from a policy standpoint of integrating seafood into our food system through some USDA policies. So I try to stay in the hopeful, and I also recognize that, we've thrown a rock in the pond and there are ripples that affect a lot of things.
It's kind of hard to speak for the whole as a VA because I was only in the education service line, but I think my biggest thing with all this is how it went down, and necessarily that it happened, but just how. Me finding out through an email and my supervisor not even knowing was the biggest thing for me. And then after the fact, the VA having to figure out what are they going to do with all the work that I was doing and how to continue that work and who is it going to land on. Hopefully going forward, I know they're looking at 80,000 jobs or something around there by August for the VA. I hope going forward they at least coordinate with the agencies and can give the people some proper either notification of, hey, your job's about to be gone in the next couple months. Try to find another job. Just give you a full warning or something like that. I just feel like as the federal government, we shouldn't necessarily do things maybe how they have been done. I think we should improve. And it should be one of those going forward, hey, your position is on the line. We're giving you 3 months. Okay, cool. Now I can look for a job instead of finding out the night before of, hey, you're gone when you come into work the next morning, turn in your computer. Good luck finding another job. Kick rocks. Have a nice day. I really think they can just do a better job. Like I said, I agree with trimming the fat, so to speak, and making things more efficient. It's just how they're going about doing it is for lack of a better term, asinine. I really think it's wrong, and it's doing an injustice, and it makes the administration not look in the best of ways.
I'm just happy to be here and have my voice heard. It's much appreciated. Thank you.
Listen, maybe stay with oceans a second. I was ask all of you. Be great to hear what's one thing you love about the work that you've been talking about today, and in your case, Ocean, what's one thing you love about the field of study that you're pursuing right now?
The inspiration to tackle further education was never and then forefront of my mind. I'd worked retail for years, and I enjoyed that. I'm excited for that opportunity, I guess, to be able to do that.
So, being a veteran, I appreciate the opportunity to actually move forward and further my career path in serving veterans. As I mentioned earlier, I didn't necessarily see myself working for education and training, but I absolutely loved it. And going day in and day out, helping the medical field just figure out, helping TOGAS, helping them figure out what training needs to be done and how to do it, and being actually asked my opinion on, hey, what do you think's the best way to go forward? It was a good sense of pride for me, and like I said, helping the veterans, that was always a fun thing to do, hearing the stories and everything like that of why they come to TOGAS. TOGAS in itself is, from what I've been hearing, an outlier from a lot of the other facilities, because sometimes you get the disgruntled the veteran saying, man, I hate the VA, it really sucks, we need to find better care. But I find it hard-pressed to find someone saying that TOGAS is not good. TOGAS VA has just been in my short period of time, it's been a strong rock for me as far as finding a career path forward. And I really appreciate, even though short, the opportunity for me working there. And I hope, especially with the recent events, that I get to go back and further my career there.
Fishing is this magical intersection of science and nature and salty grittiness. And, I am constantly surprised and encouraged by the fishermen we work with. They're smart and they care. They're some of the smartest businessmen I know. They're some of the most amazing people who love nature and want to preserve our oceans. There's a real Maineness to this industry. And I love being part of making sure that it will be here and there'll be opportunities for the next generation.
So I mentioned that one of my main constituencies is behavioral health leadership in all the New England states. But another, I would say, honestly, maybe even more important, some of the small organizations and community groups that are trying to help their communities and their neighborhoods on the ground with behavioral health, mental health, and addiction services. Three quick examples is a group in Connecticut called New Life, run by Pastor Dina Smith, who's a mover and shaker. He opened the first Black-run respite home in New Britain, Connecticut, and runs a really wonderful recovery center there. In Massachusetts, working with the Asian American Pacific Islanders Commission to try to address some of the specific needs of the Asian American Pacific Islander populations in Massachusetts. And then here in Maine, the Wabanaki Public Health organization and tribal communities trying to build, again, supports around addressing their specific needs for mental health and addiction. So that work, connecting and supporting those organizations, doing that really on the ground, kind of local work was the favorite part of my job. Before I went to SAMHSA, I was director of EdCare, educational student in Maine for 9 years, and it was all about training technical assistants and trying to build the workforce and build services. And we got a federal grant to serve New England, and that's where I kind of got my taste for okay, I want to do more. I'm a very mission-driven person. I want to help. I want to serve. I want to help Mainers and New Englanders address and support their behavioral health challenges and issues, and that's why I came to SAMHSA. I had the job I had at EdCare was mine until I retired. That was a solid job, but I wanted to serve. And so that's the thing that hurts the most about it. Is like I gave up I gave up a great job to try to serve my state and my communities, but the administration had other ideas.
Before I talk about the many things that I loved about my job, Alan, I just wanted to say that my husband is a disabled veteran, and he is the VA has been there for him for years since he left. So I wanted to thank you for your service and your service since and working with the veterans. It's so appreciated. I have wanted to be a biologist since I was a kid. I was 12, I think, when I first told my parents I wanted to be an animal scientist. They thought that meant a vet, and I said, no, not a vet. I want to be an animal scientist. I've worked in this field since I was 17, so it's been over 15 years, and it is all I've ever wanted to do. And my dad always said, if you love what you do, you never work a day in your life, and I have found that's absolutely true. My experiences as a wildlife biologist have been some of the most precious of my life. I have worked with bison and elk on the north rim of the Grand Canyon. I have captured rattlesnakes. I've captured bats. I've worked with mountain lions. I've done every single thing that you look at an animal and you say, that looks so cool. I wonder what it would be like to hold their big paw in my hand. I have done that. It's, it is so precious to me. And wildlife is, I find so much value in it because animals are innocent and they just exist for themselves and for no other reason. And we do have a responsibility to protect them and to make sure that they are not irrevocably harmed by our actions, because we have a tendency to, as humans, just have a tendency to have a very tunnel vision approach to a lot of things without having a lot of awareness of the beings around us. And there is just so much beauty that we're at risk of losing. And I love my job. And I loved my job at Fish and Wildlife. I worked really, really hard to get there. It was a career goal for me to work for the federal government. It always had been. And to lose it, it's been pretty unbearable. Just devastating, doesn't cover it. So thank you for that, administration.
I think, speaking on for the National Park Service, I think I've heard it described before as the Great American Experiment. And I wholeheartedly kind of believe that's true. I think we're fortunate to have the natural beauty protected. And I think it's important that we continue to steward that for the future to make sure that we're not only able to enjoy it now, but future generations are as well. For me and my team, I think we realize how incredibly lucky we are every day to be able to tell the story of not just Bar Harbor, but Katy National Park and Mount Desert Island as a whole. So we look forward to being able to continue to do that. And I hope we are, through the National Park Service. Thank you. And thank you all for sharing that. I think it's really powerful to hear what lights you up about the work and the paths that you've been on. And thank you for your service as well. I wanted to give anyone the opportunity to share anything else about impacts of these federal actions on your work or the programs and organizations that you've been involved with that maybe you haven't had a chance to share so far in the discussion. Is there anyone that, yeah.
Actually, what I wanted to say, when I think of everyone that's at this table and what everyone is involved in, I can't think there's a single Mainer that's not impacted by at least one of us, if not all of us. So I just think that's an important thing to point out when we got veterans in parks and in fishing. Like, I can't think of a single Mainer that would not be impacted by at least one of ththese cuts, if not every single one of them. I mean, this again, my realm of behavioral health and addiction, we know how many people are impacted by that. So I think I just kind of wanted, that's just kind of my observation that just in this small group, and there's so many more of us out in Maine that have been impacted by this as federal workers. And so I just want to hit that point home that like every single Mainer is impacted by this, whether they know it or not. And so I guess that's part of our job and part of your jobs to like make sure that Mainers understand that and the implication of this, because no one's going to be untouched. But, you know, and I've been a little salty, but I do have some hope. I mean, I think, again, that all of us came here to do this, and there's so many more that are trying to share their stories. Like, there's this sort of meme or perception of what a federal worker is and what we do or don't do. But like, these are all very passionate people that came to do this work because we just wanted to serve. We want to make our state better. We want to support people. So I think that's an important message to kind of take home. And for me, that I hang on to, that like we'll figure out ways to still serve in the way that we want to serve. And but it could be a lot easier if they weren't doing this.
I just wanted to take a moment to speak on behalf of my colleagues who are still employed. At least at Fish and Wildlife, I don't know about other agencies, but I imagine it's similar. They are currently subjected to a very hostile and traumatic work environment, and this is by design. There are members of this administration who have said on record that they want to put federal employees in trauma. They have succeeded. They absolutely have done so. And the goal is to make my colleagues' daily lives so miserable that they will quit their jobs. In what world can an employer treat their employees that way? For example, charge cards our credit cards have a $1 per day limit at the moment. That makes routine purchases like toilet paper or putting gas in our cars or paying the electric bill at our wildlife refuges. It makes that impossible to do without higher approval by somebody from the regional office. They are being set up for failure so that the government can later justify firing them. Despite this, I know that my colleagues will stay in their jobs as long as they possibly can. And I know that myself and many of the fired federal employees will go back to our jobs in a heartbeat if that means that we can keep doing this work that we believe in so much. I just wanted to make sure that we speak on behalf of our colleagues who are still employed at the moment.
I just want to say thank you to our delegation. You've heard from all of us, all the things that are hard, and I don't think that it is lost on all of us how hard it is for you right now. How many fires you're trying to put out and how many people are calling on you for help. So I want to make sure that our delegation knows that we are here for that you are here for us. Doesn't mean we're not going to call and ask for more help, because we absolutely are. But we know that you are fighting fires on all fronts, and we appreciate it.
So I definitely used to be the person that kind of laid to the wayside and just kind of watched everything happen. My wife was more the advocate, and I always supported her for it. She's super passionate. It wasn't until this happened to me that I was like, uh-oh, like it's kind of at my front door. This is really affecting me. And I just plead to other people, don't wait until it's too late. It's been a hard lesson for me, and luckily, like I said earlier, I had the support that I have with family, friends, and past coworkers and future coworkers and whatnot. Just I have the support, so I'm fortunate. But this is affecting everybody across America, and it's one of those. Just if you have a voice and you have the opportunity, please take it. Take the time, speak your piece, try to be respectful, but, emotions fly. But it's just one of those, don't let it be too late. Thank you.
I think that's a great note to end on, Alan. Thank you. And I just want to say again, a very big thank you to all of you for sharing your stories with everyone today, and for all the work that you have done on behalf of Mainers and Americans. And thank you for your time.